In order to combat the COVID-19 virus right here on St. Martin, we are introducing a vaccine that will save lives. And that is the reason I will be taking the vaccine.
The COVID-19 vaccine teaches your immune system how to deal with the COVID-19 virus. It protects you by creating antibodies, which are activated to fight the virus.
The COVID-19 vaccine protects you from the severe side effects when contracting COVID-19 virus, which in severe cases can lead to death.
Once you have the vaccine, your immune system recognizes the virus and attacks it, making your body better able to fight it off. To put it simply, the vaccine is a training for your immune system.
So vaccination is necessary to boost your immune system, to lower the infectiousness and spreading in the community, and to make you less prone to serious disease and complications.
These vaccines do not typically cause long-term side effects because once the material is introduced into your body completely eliminates it within a short amount of time. The only thing that remains is your immune system remembering what it is, what it looks like, and how to fight it. The vaccines will not and cannot alter your DNA.
Listen, it's okay to be concerned at how fast the vaccine was developed. Fortunately, researchers have been studying and working with this type of vaccine, called the mRNA vaccine, for more than 10 years to battle infectious diseases. So, the basis for the research already existed.
For the COVID-19 vaccine, processes that usually happen one after the other, such as securing funding, testing, approval, and distribution, all happened at the same time, speeding up the process while not skipping any steps, processes, or phases. Because of the magnitude and impact of the COVID-19 pandemic, it was also easier to secure funding and find willing participants for the vaccine trials.
All of this made it possible to safely develop a vaccine, a process that typically takes 5 to 10 years, in less than a year without skipping any of the necessary steps. The vaccine also received emergency approval from drug safety bodies such as the Food and Drug Administration in the United States, the European Medicines Agency, and the World Health Organization.
If you suffer from severe allergic reactions, you should consult your family doctor prior to taking the corona vaccine. All medications and also all vaccines that we had in the past have the potential to cause an allergic reaction or cause any type of side effects. In general, those side effects and allergic reactions are very mild.
Persons under the age of 16, as well as pregnant and breastfeeding women, were not part of the vaccine trials. So there's no data available as yet on how they will respond to the vaccine. While it is assumed to be safe, at this moment, it is not recommended for these groups to be vaccinated.
The elderly are at a higher risk for contracting severe COVID-19 and are strongly recommended to take the vaccine. You should do it for your parents and grandparents, as I will do it for my clients.
Vaccination is necessary to boost our immune system, prevent serious disease and complications, and lower the infectiousness and spreading in the community. The COVID-19 vaccine is not mandatory, but taking the vaccine protects you and your loved ones.
The vaccine is free for all residents of St. Martin, whether you are documented or undocumented. So to protect yourself and your family, I encourage you, take the vaccine.
Good morning to the honorable ministers of the council, members of the media, online viewers, radio listeners via St. Martin Grove Radio 107.9 FM and respective radio stations island-wide. I am Charity Dunker, and welcome to the Council of Ministers live press briefing for today, Wednesday, February 3rd, 2021. Before we begin, I'd like to announce that the Minister of Romi, as well as the Minister of Finance, the Honorable Prime Minister, also Minister of General Affairs, will not be present for this morning's Council of Ministers press briefing as they are busy attending the Parliament meeting for this morning. Moving forward, at this time, I'd like to invite the Minister of Education, Culture, Youth and Sport, the Honorable Dr. Anders Rudolph Samuel, to address you. Good morning, Minister.
Good morning, Ms. Dunker, and a blessed day to you. Good morning to my colleagues. Good morning to the media, and good morning to the people of St. Martin. Today, I would like the public of St. Martin to please be informed that the Inspectorate at the Division of Inspection of Education, Culture, Youth and Sports has decided to make the following adjustments effective February 1st to the truancy-related request processes. When a child will be absent from both face-to-face classes as well as online classes, the parents' guardians must request an exemption. Exemptions requests can be made for the following reasons: medical appointments in connection with SLV, immigration matters, educational, cultural, and sport matters, relocation, and personal matters. To apply for an exemption for any of the aforementioned reasons, the parents or guardians must make contact with their child's school to request an exemption form. The school will issue a stamped signed exemption form to be submitted to the Division of Inspection for approval. The documents needed to support the exemption request are copy of the parents or the guardian's valid passport or ID, copy of the student's valid passport or ID, flight reservation, and please do not purchase the tickets until the exemption requests have been approved by the Division of Inspection of Education, Culture, and Sports. Invitations or death certificate, obituary, or any other document supporting the reason for request. Once all documentations have been received from the school in good order at the Division of Inspection of ECYS, the request will be processed and the response will be emailed back to the school to be delivered to the parent or guardian. It is important to take note that the Division of Inspection will not be receiving in-person requests at the office until further notice. All requests must be done electronically via the school. All responses are sent electronically also to the school. In the event of an emergency, appointments will be made. I thank you for today, Ms. Dunker, and I await any questions.
Thank you, Minister, for your opening remarks. At this time, I'd like to invite the Minister of Justice, the Honorable Anna Richardson, to address you.
Good morning, colleague ministers, Ms. Dunker, DCOM, the press, and to the listening and viewing public. I would like to give some updates with regards to the status of the function book for the Ministry of Justice. On December 22nd, 2020, the function book for the Ministry of Justice was handed over to the CCSU for review and advice. The CCSU was given 6 weeks to render their advice, which meant that the 6 weeks advisory period would have ended on February 2nd, 2021. However, on Thursday, January 27, 2021, a letter was sent to the lead of the group for the workbook, the function book, the work group, Mr. Lute Hackens, with further attention to me as Minister of Justice requesting an additional 4 weeks. It is important to note that the function book that is currently in the hands of the CCSU is not only for CAPSM, but it is that for the 9 departments within the Ministry of Justice. As such, with taking into account the Christmas holidays and the quantity of function books into consideration, I did not hesitate to grant the CCSU an additional 4 weeks as requested. The CCSU will then have until March 1st, 2021 to render their advice. A little update about the Department of Immigration and Border Protection Services, which we know was closed on Wednesday, January 27th, 2021, due to the positive or some positive cases of COVID-19. The 2 executive buildings at 80 Illich Road were all deplaned last weekend on Friday, Saturday, and Sunday. 5 members of our staff have tested positive, and a few of others, after contact tracing, have been placed in quarantine by CPS to monitor for symptoms. Yesterday, February 2nd, I, along with management, held a meeting with approximately 11 staff members who have tested negative and/or are not a part of those who needed to be quarantined. IBP will resume operations on Monday, February 8th, 2021, with a limited service due to quite a number of the staff being out. However, the team that will resume on Monday has made a commitment that they will work to the best of their ability and with capable manpower to process applications in as a quickly manner as possible. We are in the process of launching a proper COVID policy for the workplace to better secure the staff and clients, with hopes to reduce these reoccurrences, as we are aware of the impact that it has on both the staff and our clients. I'd like to take this time to speak a little bit about the accident that occurred on Monday, February 1st, 2021. Firstly, thank you to those who called, messaged, and expressed concern and best wishes for both myself, or my person, and Mr. Wilson. I spoke to Mr. Wilson yesterday. He's doing fairly well, although he was experiencing some headaches and leg pain. So I arranged for him to be taken to St. Martin Medical Center for a second follow-up check. And they as well confirmed that he has no serious injuries. What he's experiencing now is expected because of his blood being cool again, etc. But we did arrange for him to visit his house doctor by the advisory of the medical center, so that he will be taken there today to continue checking up on him. But I just wanted to give a little insight about the accident. I know it has been magnified because I am a minister, but the reality is that the intersection, as you're entering or wanting to turn into St. Peter's, which is where I was en route to, is a very dangerous one. I was able to obtain statistics from the traffic department at CAPSM. It turns out that at least 5 accidents of the similar kind took place within the last 2 years. 3 occurred in 2019 and 2 in 2020. So you're going on your way on LB Scott Road, and I slowed down. There was no cars coming from South Reward. I'm about to turn into St. Peter's, but I wanted to make sure that there was no cars coming from St. Peter to turn to South Reward. There was none. It was quite dark as well, and that is an aspect that I will be having a discussion about. So as I turned, I didn't really accelerate that quickly, but as I turned into St. Peter's, Mr. Wilson and I collided. And it was a very traumatic experience to go through. But I believe that it happened because as minister, I have a responsibility to not have this happen again. As a matter of fact, I was even informed that a few years back, a gentleman who volunteered himself to escort children to cross the street there due to the complexity in the traffic system, he lost his life a few years ago. And I was unaware of this. As a matter of fact, I've been advised that this happens more often than we realize. It happens more often than it's even recorded by our traffic department. I was advised by my older brother that he had a similar incident in December. Our father as well apparently knocked someone down there also. So this has been going on for quite some time. The area is very dark, and it has my attention now due to this experience to address it. I will be meeting with the traffic department so we can discuss this, and I will do all things within my capacity as Minister of Justice to deal with this matter. So I just wanted to bring those updates and details. I believe everything happens for a reason, and it has really rattled me, but I am regaining my focus, and I will be addressing this in my capacity as Minister of Justice. Ms. Dunker, that is my updates for now, and I am here and available for any questions that the media may have. Thank you.
Thank you, Minister of Justice. At this time, I'd like to invite the Minister of Tourism, Economic Affairs, Transport and Telecommunication, the Honorable Minister Ludmila De Wever, to address you.
Thank you, Ms. Dunker. Good morning, colleague ministers, members of the press, and the viewing and listening public. I just had a brief announcement or clarification to update the public on today. Last week, with the advice that we received from the Netherlands, we had a travel ban that was put in effect. And this affected the Dominican Republic as well because of the fact that it is another hub to get to South American countries that were banned. What we have decided as an update today is considering that thanks to the information I received from the airlines that take our travelers between here and Dominican Republic, over 90% of our passengers are St. Martin residents from both sides of the island. And the changes that will go into effect is that the flights to the Dominican Republic can remain. The requirement will be that 72 hours PCR testing is required for all passengers, specifically our residents, who will no longer be able to test at Princess Juliana International Airport. And they will. We also made contact last year when we reopened the flights to the Dominican Republic. We made contact with labs, local labs in the Dominican Republic with the assistance of HCLS here and Dr. Faye that can perform this testing for us within 72 hours, making it possible for us to at least keep this very, very, very important leg and link to Dominican Republic open for future flights. The changes that will be revisited on February 12th is whether or not we will allow other passengers to travel on this flight. So as it now stands, St. Martin residents can travel back and forth to the Dominican Republic. As of February 12th, any other passengers that have not been in the banned countries for a period of 14 days will then be allowed to travel back to St. Martin. But we will be sending out a public announcement and further clarification on that today, as well as any updates that come next week once we know more about the variant being in the Dominican Republic. So I think that actually puts a lot of our residents and citizens at ease for having that leg open for the time being. Thank you very much, Ms. Dunker. That is all. And as I notified beforehand, I will not be here after 10:30 a.m.
Thank you, Minister of TIAT. At this time, I'd like to invite the Minister of Public Health, Social Development and Labor, the Honorable Minister Richard Panafleck, to address you.
Thank you, Ms. Dunker. Good morning to the members of the media, my esteemed colleagues of the Council of Ministers and the people of St. Martin. As of February 2nd, yesterday, 1,885 persons had a laboratory confirmed COVID-19 infection. To date, there have been 1,710 persons that have recovered from COVID-19 and 27 persons have passed away, unfortunately. There are currently 148 cases that are actively being monitored by CPS. The number of daily new cases continue to be high, around 15 per day, which likely indicates a high level of transmission in the community. COVID-19 vaccination update. As has been communicated previously, the 4 countries of the Dutch Kingdom are working in cooperation to execute the vaccination program, sharing in the vaccines bought and provided by the Netherlands. As part of the total operation, in last week's press briefing, I communicated to the public that CPS and Public Health hosted a visit by the VWS team led by Dr. Mark Sprenger on behalf of the State Secretary Paul Blokhuizen of VWS. This visit was to assess St. Martin readiness for the coronavirus COVID-19 vaccine and to lead a cold chain training for the professionals who will be involved in the COVID-19 vaccination campaign. A vaccine management team consisting of senior officials of VSA, non-governmental partners, has been established to prepare and implement the COVID-19 vaccination campaign with the support of a range of professionals. Activities included informing doctors about the administration of vaccine, providing a safe storage location, arranging transport and distribution of vaccinations. I can also say that community leaders, as of last night, also were informed and will be continue being informed. The ministry is also developing a registration system for the COVID-19 vaccination program on St. Martin. I'm happy to inform you that we have received confirmation that our COVID-19 vaccination plan has been verbally approved by the team for VWS and that the first shipment of biotech Pfizer vaccines will arrive at the Princess Juliana Airport on St. Martin around February 15. This is good news for all people on St. Martin as we will enable us to protect ourselves against the COVID-19 virus. Getting out of this pandemic also means that we have the opportunity to restore our path towards social development and economic prosperity. We are aware of the fact that some of you wonder if the vaccines will be effective and safe to use. However, I can assure you that the vaccines has been rigorously tested by renowned testing institutes and laboratories in Europe and in the USA. The testing results on safety and effectiveness of the Pfizer vaccines have been very positive. If you doubt or are in doubt, I recommend that you have a conversation with your family doctor, read and watch vaccination-related messages and communication on official media such as the government St. Martin's COVID-19 page, the CDC, the REVM, the ECDC, or the WHO. The first phase of the campaign will focus on vaccinating all persons above the age of 60 and the frontline workers from the health frontline workers. Sorry about that. We have the ambition to vaccine all adults above the age from 18 and above before the hurricane season of this year starts. With your understanding, cooperation, and support, we can make the upcoming vaccination campaign a success. As the public may be aware, there are currently new variants to the COVID-19 virus circulating around the world. 3 of these new variants have shown to be more infectious than the original COVID-19 strains and have originated from South Africa, Brazil, and the United Kingdom. If left uncontrolled, these new variants can lead to an exponential rise in hospital admission and death within a few weeks. If they are introduced to St. Martin, it will be a severe impact on our health services and resources. The Collective Prevention Services is closely monitoring the presence of the new COVID-19 variants on St. Martin. They are collaborating with St. Martin Laboratory Services to send weekly samples to REVM in the Netherlands for genotyping. That means to see if the positive tests are of the new virus, any of the 3. This may be a specific strain of COVID-19 virus can be determined. Among the first batch of 10 samples from COVID-19 patients from St. Martin that were sent last week, none of the new variants were detected. I continue to urge the general public to implement the public health measures of the wearing masks, keeping your distance, and frequently washing your hands. CPS increased its testing capacity and since January 11 have expanded testing to anyone who would like to be tested. To accommodate this increase in testing, CPS has adjusted its drive-through hours. During the week, testing will be available from 8:30 in the morning till 11 in the morning. Weekend testing will remain by appointment only. I commend the public for coming forward for the testing and continue to encourage persons to contact CPS at 914 for any questions of concern. May I thank you and may God bless us all. Thank you very much, Ms. Dunker.
And thank you very much, Minister VSA. Before we move forward with the question and answer round, I'd like to re-invite the Minister of Education, Culture, Youth and Sport, the Honorable Dr. Anders Rudolph Samuel, to address you with more statements for this morning.
Thank you, Ms. Duncan. Ms. Duncan, I would like to make use of this opportunity to remind the applicants that the applications for study financing from the government of St. Martin will end on Friday, February 12, 2021. So this is a reminder. And to apply for study financing, the applicants must first request a crib number from the tax inspectorate. Go to www.studyfinancing.sx or www.studyfinancing-sxm.com. Review the 2021 study financing priority list. Read the terms, conditions, and criteria for study financing, or view the videos of the study financing webinars posted on our Facebook page. Fill in the online application form and upload the following requested documents. This is a reminder, so I won't read all of the notification this morning. I thank you, Ms. Duncan.
You're most welcome, Minister Samuel. If you have just tuned in, you're logged into the live Council of Ministers press briefing for today, Wednesday, February 3rd, 2021. Thank you for joining us. We now move on to our question and answer round. From the media, I'd like to invite Ms. Bibi Shah of SMN News. You have the floor. Good morning, Bibi.
Good morning. I'd like to ask the Minister of Health. He has not only the health portfolio, but at least he also has the labor portfolio. Minister, I know you're swamped with what's going on with COVID-19, but can you give us some update as to what exactly is taking place when it comes to controlling the labor sector, and what more is being done, or what exactly is being done to assist people that are in need for social benefits and social assistance? How are you revamping that part of your ministry?
Thank you, Ms. Shaw. To address your question about the labor situation, there are two ways that people can be helped through the program that government has. One is the SSRP, and one is the financial aid that is of government. The financial aid is a part that has been there for many years. So that's nothing new. But those people that especially lost their jobs because of COVID, and they were either self-employed or had employment in certain branches, is being helped with financial support. As latest information I got, the financial support amount of request has grown from 375 to 430 in the last period from December to right now. About the financial aid that governments provide those that have no means of maintaining themselves, that is something that fluctuates from month to month, where it's more or less about 500 to 550 people that are being helped in one way or the other. So I hope that I have answered your question.
Charity, can I get a follow-up, please? Minister, and I listened to what you said, 550 people that are getting help from government. And I'll draw your attention.
I didn't say that. I said there is a financial aid.
Yes.
And then there is a aid support. There's two things, to have two different things. Okay.
All right, excuse me. Thank you, Minister, and also Bibi Shah. You can proceed with your follow-up question. in our second round. Moving forward now to Dimitri Whitfield of the Daily Herald. Dimitri, you have the floor.
Thank you very much, Ms. Dunker. Good morning to the Council of Ministers, to the people of St. Martin. Good morning to my colleagues in the media. My first question I would like to ask to Minister Panafleck. Minister, you issued a press release yesterday about the Brazilian, South African, and UK variants of COVID-19. Fortunately, none of these variants have been detected in St. Martin so far. And last week, the 10 samples were sent to the RIVM in the Netherlands for genotyping. Based on my rough estimate, by looking at the daily COVID-19 updates, this is about 10% of last week's positive cases. In the press release, you said that samples will be sent every week. Approximately how many will be sent every week? Also, what is being put in place to ensure that this sample is representative? Thank you.
Thank you, Mr. Whitefield. Based on the amount of positive tested persons, they will send to the Netherlands, because that is a testing facility that is in the Netherlands within the kingdom, to do the genotyping to make sure, or at least to try to find out if any of the variants reach our shores. The mere fact that you send samples, like the word says samples, that don't mean that you send all of them. And the other thing is, it's not 100% that the variants reach our shores already. But we are trying to get information as fast as possible. Every time we send the samples, it takes a little while. It is not like with a PCR testing that you will get it the next day. It takes a little while. Like, for instance, if I may do that for the clarification's sake, by the time it hit the news that Aruba had 5 positive on the variant, the people were recovered already, because it took quite some time for them to do that kind of testing for you to get the understanding. But still, we will, all of us, continue doing that, because at least if we know, and God's willing, it's not every time negative, that how are you going to continue to adapt your protocol to deal with the situation of the pandemic? Thank you.
Thank you, Minister, and thank you, Dimitri. And now I call upon Lyndon Brown from BCN TV. Lyndon, good morning.
Good morning, Charlie, and good morning to the people of St. Martin and the ministers that are present here today. Question to Minister Panafleck. Minister, the people are concerned about a vaccine. What is the evidence? Is there any evidence that you can bring to the people of St. Martin that the vaccine has working? People are very concerned about that, Mr. Panafleck. And why, if it's not working, why there are so much emphasis on the vaccine?
Thank you, Mr. Brown. The experience that exists worldwide right now gives that it works, not only by the testing and lab situation, not only by the phases that the vaccines went through, but also with communities that have mass testing right now, because the vaccine is being used. Over millions of vaccines has been already injected, and people have it. And there are countries like Israel, might be far, but still they have the means to do it, that they are already over 2/3 of the population that are giving them the second vaccine. And what they are realizing is that the infectious rate of the COVID pandemic drastically dropped. I understand, and that's why we had already 2, and we will follow, like I said, more sessions of information where we had the general practitioners bring in, and we invited Dr. Duits, that is an immunologist from Curacao via the Teams. We had a session. He explained to the doctors in doctor's term, you know, they have their professional terms they're talking to. They could ask him questions. He answered them. And yesterday we had one with the community leaders of some of the parts of the communities and explain them the same thing. And then they could have asked questions so that they can go back to the community and relate them. The vaccination, as far as humanly we can tell, and the results of the test that's being done by both the European Medical Association, the FDA from the States, and many others that did them also for the countries, is that the vaccine is safe. One of the reasons why they're using Pfizer at the moment, because Pfizer have a 95 plus efficiency, but also that is one that was tested the most with the people over 60 years. You have different protocols of how you're going to disturb the vaccines, but basically in the kingdom, for the islands, we have agreed that we will start with the medical professionals and the 60 plusers, and after that we will do for the rest of the population over 18 years and older, so that we can hopefully reach to have vaccinated the vast majority of the community prior the third quarter of the year that we know will start with the hurricanes. I hope that I've answered your question.
No, sir, no, but that's okay.
Thank you, Minister, and thank you, Lyndon Brown, for those statements and the question, answer and question. Moving forward to Jeffrey Sackrin from Island 92, you have the floor.
Thank you, Ms. Dunker, and good morning to everyone. This question, I think, perhaps is best addressed to both Minister Panaflak as well as Minister De Wever. Is the government and are your respective ministries aware that since we've changed the testing requirement starting February 12th to 72 hours, many hotels, guest houses, villas are receiving numerous cancellations because our visitors simply can't meet the new 72-hour rule for a PCR test or the 48-hour rule for the 4 accepted antigen tests. I believe at this very forum, we have said time and time again that the spread of COVID on the island is community related and not related to our tourists. I think we also further described the number of positive cases detected at Princess Juliana International Airport as statistically insignificant, and that many of the cases that were detected there were from returning residents who at the time weren't required to test before they arrived. So we seem to have a kind of one-size-fits-all approach that doesn't seem to be taking some of the facts into consideration. Is there a way that we can be a little more nimble in our approach, and that being a little more nimble might go a long way towards promoting economic health as well as public health? Thank you.
Thank you, Mr. Sakri. Yes, we hear about it. So we will adjust that accordingly so that the required 72 hours for the market of US will remain under 120, that's 5 days. I guess with that being said, all can be, don't have to worry. But I have to ask a question. When we was doing the PCR test, the same question came. The only thing was said is, yes, but it's better to do the antigen test. So we took our due diligence and we did the antigen test. But now it seems that everybody is telling me again, I don't have a problem. Telling me again, it's the PCR test that the travelers are using. But like I say, we are a friendly island and we will accommodate. So for the US market, we will maintain, because it was going to be in effect of February 12th. So we will maintain the 120 and hopefully everybody's happy then. Thank you.
Minister De Wever, are you able to answer the question from Mr. Sakrin?
Thanks, Ms. Dunker. I think Minister Pontifex answered it properly. When the announcement was made last week, we said that we will be potentially changing to the 72 hours as a result of reacting to the new strains that are out there. So yes, we have been fighting this since last year to increase the 72 hours to 120 hours or 3 days to 5 days. And the consideration came as part of our discussion with the Netherlands, with the whole vaccine rollout, that we would have to get stricter and also even potentially match the French side again. That conversation came up. So as of now, we said that we will look at the 120 hours being reinstated on the 12th, which is way in the future, that we were looking at potentially doing it. So if hotels have faced cancellations, that is unfortunate, and that is not the intention of us here as government, but our intention is also to keep the country safe and to keep the economy going, but in a safe manner. And we do have the strains in the US, and that is something that we have to keep in mind, that we are still living in pandemic times, and we are actually one of the most normal places as possible in the world right now. That makes tourists happy to be here, and we don't want to deter them, but we want to ensure that we continue providing a safe destination for our visitors and a safe country for our residents. That's all I have to add. Thank you.
Thank you, Minister, and thank you, Mr. Sakrin. Stephen Cyrillian of PJD2 Radio, good morning to you. You have the floor.
Thank you, Ms. Dunker. Good morning to you. Good morning to the ministers in the virtual setting as well. My question is for the minister responsible for ECYS, Dr. Andres Fridolf Samia. He stated that the application or deadline for application for study financing is set for Friday, February 12th. Can you say, Minister, as to how many persons have so far applied for study financing and what areas of interest are you observing?
Good morning, and thank you, Stephen, for the question. At this moment, a tally has not yet been made on the amount of persons requesting a scholarship and in which area they are requesting a scholarship for. I know one of the things that we are doing is accommodating those students at the civil registry area in order for them to be able to get the forms that they need more easily. So that is one of the assistance that we have been making more easily for them. But when the February 12th is reached, we will be able to make the tally, and then we would be able to bring this information to you, sir.
Thanks.
Thank you, Stephen Cyrillian. Before we move forward to the second round of questions, which will also be the last round of questions due to time constraints, I'd like to remind members of the media to keep your questions short and concise. Moving forward into our second round, Bibi Shah of SMN News, you have the floor.
Thank you. Thank you. I'm having some problems with internet. I don't know if you're hearing, but I will pose my follow-up
Yes, Bibi,
question.
we can hear you.
Okay, Minister Panafleck, when you gave the response to the questions I asked about the assistance given to people from social affairs and the Labor Department, you gave figures, I have them. But what my concern is, and the reason for my question, Minister, is yesterday in Parliament, the information came out that the Red Cross is giving the people that they're assisting, 70% of them are undocumented. I can tell you that this raised eyebrows because there are so many people on the island, residents, born St. Martin people living here legally, that are saying that they're reaching out for assistance and they're not getting it. So I'm asking you exactly how many people are getting help. I'm not talking about SSRP, I'm talking about social assistance from the Department of Labor and Social Affairs.
Thank you, Ms. Shaw. As the information reaching me from the social department, as you are stating, those that are being helped have to have a residency to being helped. Otherwise, they can't be helped. It's only the, let's put it this way, only the legally documented residents will be helped by social affairs. I don't know if what you are saying, I didn't get no proof, because when I see the documents have all people that are living here legally. You froze. Thank you.
Thank you, Minister Panafleck, for answering the question. Moving on now with Dimitri Whitfield of the Daily Herald. You have the floor.
Thank you again, Charity. Is Minister Duiva still in the meeting?
She just left. You'll have to forward your question to her ministry.
In that case, I'll ask my final question to Minister Panafleck. Minister Panafleck, for the past 8 weeks, we've all been eagerly awaiting the country's vaccination strategy. Today, you said that the plan has been verbally approved, and I think in response to a question by my colleague Lyndon Brown, you gave some details about the vaccination plan. What more can you divulge about the plan? Specifically, will non-residents be able to get the vaccine under St. Martin's vaccination strategy?
Thank you, Minister Whitfield. To start the first, if non-residents means people that are visiting the island as tourists and so, no, they will have to get vaccination in their country of residency. Besides that, everybody, let me explain it. When I say everybody, everybody that has St. Martin as its home, that are residing in St. Martin, will be vaccinated, with one exception. Actually, two. Right now, if you're under 18, you will not be vaccinated. And if you don't want to be vaccinated, you will not be vaccinated. Other than that, everybody that resides within the boundaries of St. Martin, that side, will be vaccinated. Did I answer your question?
Can I ask a clarification, Charity?
Go ahead.
Yes, real quickly.
My clarification, so that means that someone without a St. Martin form of identification can still get the vaccine in St. Martin?
As long as they live on St. Martin, and St. Martin is their residence, they will get vaccinated. You wasn't there last time, so I'll tell you. If somebody comes here and stay as a tourist, or like they say, overwintering for 3 or 6 months, No, the residency is where they come from, where they really live, because all nations are calculating it themselves. Here in St. Martin, we are calculating all that are living on the territory on St. Martin. What they say in civil law, you're doing your private life, you do it here. Am I clear?
So that means undocumented immigrants will not be applicable for the vaccine, correct?
No, this issue has been dropped. Everybody, when I say everybody, we don't make no distinction. If you got documents to be here, you're born here or not. As long as you live here, this is your place of living, residing, you will be vaccinated and you will be counted in.
Thank you, Minister, and thank you, Dimitri. Lyndon Brown of BCN TV, you have the floor.
Question to the Minister of Justice. Minister of Justice, is she there?
I'm here, Mr. Brown.
Okay, Minister of Justice, I want to engage with you today, verbally. Minister of Justice, there are a lot of people who have temporary document here in St. Martin. And it's slated now for them to renew. It has been expired. And they are waiting anxiously to get their document. Minister, and there are a lot of people right now that their document have been refused. For what reason? Who will be the front liner now to get document? Because according to information I got, a lot of people, document is being refused. So can you weigh in on this matter? Can you clear the airways, Minister, so that the people will not waste their time or waste their money fighting to get document in this time of crisis? So can I just make it clear so that people can be at ease?
Thank you for your question, Mr. Brown. Firstly, we're not wasting money because we are following the process as it is written. I will say to you that I do not have the statistics in terms of how many applications have been requested, how many have been declined. But as I've said previously as well, that a lot of practices, unethical practices, were being used to acquire residency on the island, and a lot of that has been unfolding in the process in the recent months. However, I urge all persons who have requested or placed an application, in the event that you have received a negative response, you have the opportunity and availability to appeal a decision. So the decisions are not necessarily final, but it is good to appeal it, because then you also get a chance to sit with the appeals committee and identify what it is about your request that is not meeting policy and law as it is written. Together, you can work with them to see how that can be mitigated, and the first decision can be overturned as long as you are meeting the criteria and regulated policy as it is stipulated. And that is just simply the case. So if you have received a negative response, please utilize the appeals committee to be able to represent your case, have a discussion and identify what changes can be made, what additional documents you may need to submit, proof of income, etc., to satisfy what is necessary. I hope I answered your question.
Thank you, Minister, and thank you, Mr. Brown. Jeffrey Saccharin of Island 92, you have the floor.
Thank you very much, Charity. It has become, I think, very evident, and perhaps in the absence of Minister DeWeaver, that Minister Panafleck and perhaps even Minister Richardson might be able to address this. There are many, it has become obvious that there are many businesses that are operating without following the COVID-19 protocols. Many follow the rules that require masks and social distancing, and there are many that simply think it's their prerogative not to follow the rules because they just don't believe that COVID is a reality. What are we going to do? How are we going to allow those businesses that are following the rules to prosper? And how are we going to clamp down on those that are not following the rules? Because to be quite frank, I think our own health truly depends on it. So I'm hoping that perhaps you can give us some insights as to what controls can be done, what can be done to really stop those that are violating the rules and encourage those that aren't to follow the rules. How do we fix this problem? Because it's becoming bigger and bigger and bigger. Thank you, ministers.
Should I go first?
Sure.
Thank you, Doc. I will do a little psychological, and then I'll give you another answer. People are as people are. Some obey and some don't. It's the same thing with the vaccines. Some are eager to get vaccinated because they understand that only if we do it massively and most of us, if not all of us, is vaccinated, that we can go back to live as free as possible because we are protected. And some of us choose to believe whatever is out there in the world stating it is a fake or farce. It's likewise with the adhering of the protocols. There are people that concerned about their health and their loved ones, and there are those that think living today and we will see tomorrow, that is their motto. Thank God we are living on St. Martin, being a democracy, and people have free wills. I have said it before, and I will repeat it again. There are those that if they was living in countries that have totalitarian, they don't have a choice. But the thing is a pity that people misuse their freedom and don't take care of themselves and don't consider others. Going and locking down places, one or the other, and things like that. It's not because it's a challenge, but you see, we are adhering and talking to the people for them to understand it's not about themselves, it's about the community you form part of. Your actions will determine how we will continuously as a people progress. If you continue thinking as a selfish individual, then tomorrow, as the economy won't be good as it used to be, and you lose your job, I don't wish that, but I'm just telling that some might understand because they went and not adhering to what is being told worldwide for the over 10, 12 months now, 13 months now. It all have effect with each other. So yes, there are some where you go, you see they're adhering to the 2 meters. If you're not from the same household, you don't sit at the same table, you keep your distance, you sanitize, you put on your face mask, and you think. It's not only for you. Like explained yesterday to the community leaders. If we got all vaccinated and one in the middle is not vaccinated, because of the vaccination and protection of us all, he also will be protected, because the virus jumps from person to person through your breathing system. And if it jumps and it's being fought all the time, it will die out. Am I clear, Mr. Scott? Thank you.
Thank you, Dr. Sock, for your question. I think that the Minister of Health has really elucidated on that subject matter quite extensively and in quite detail. But from a law enforcement perspective, I really would appreciate as well, and speaking on behalf of our police officers who are the ones that are expected to enforce closing times, etc. There are a lot of practices that are still happening within our community where, despite you're supposed to close at a certain time, we know there's a practice of closing windows, shutters, and doors to make it seem like the establishment is closed, but in actuality not. That gives our officers a strenuous now responsibility to have to knock on doors, and you know, much debates are taking place about it. That is an interaction that we would like to see minimized. We would like to see the public really take serious to what we're dealing with here. Again, I always say this is not a St. Martin situation. This is a global matter, and all persons in this are trying to do the best for the sake of our health and our loved ones. So, you know, it's a plea again to the public to please not make this process difficult, but we should unite as a people for the welfare of those that we love, ourselves and our community at large. So from a law enforcement perspective, we are hoping that the people will indeed take responsibility and onus of the fact that we each have a responsibility to keep us safe and those that we live amongst. So that's my only addition to what the Minister of Health has indicated. Thank you.
Thank you, Minister, and thank you, Mr. Sakrin. Stephen Cerillion of PJ82 Radio, you have the last question. Please bear in mind the time.
Thank you, Ms. Dunker. My final question is for the Minister of USA, Mr. Panafle. World Cancer Day will be observed tomorrow, February 4th, Minister. What is your initial message to the many persons in our community suffering one form of cancer or another?
Ms. Donker, I don't know if you listened to Mr. Cerillion, but if you did, could you ask him to repeat, because the audio, I couldn't follow.
Yes, Minister. Stephen Cerillion, can you please repeat the question once again for the Minister?
Can you hear me now?
Yes.
Minister, World Cancer Day will be observed tomorrow, Thursday, February 4th. What is your initial message to the many persons in our community suffering from one form of cancer or another?
I heard about the suffering, but I didn't hear why suffering from what.
World Cancer Day for tomorrow.
Yes, thank you, Mr. Cerillion. Yes, one might even think that the pandemic situation take all the concentration and efforts to the pandemic. But yes, life continues having its other challenges too, as the cancer. And as the Minister of Health, I I remember that when they had the campaign about the breast cancer awareness, that I told the people and advised them to continue doing your checking, go by your general practitioner. They will advise you as soon you hit the age of 50, they say. Actually, there are some, they say you have to start by 45 and up, and do your yearly checking to make sure that if you get detected as early as possible. I wish everybody the best of health, but in case you encounter yourself in those situations, the best option for you to be helped is if you are detected as early as possible. Ms. Dunker, may I say something?
Real quickly.
Yes. Coming back, when Mr. Shaw asked the question, I was answering to the financial aid. Now, I get a message to also address that the social services helping register residents, that for them to be able to have through the social department so that they can get help. There are, because of since Irma and now with the pandemic, there are other institutions outside of government that also is helping, as we know. The Red Cross is one of those institutions that is helping everybody residing on St. Martin. When I say everybody, that means they don't make no distinction between if you're a registered resident or not registered resident. If you are from here or you're undocumented. So they help everybody because that is a humanitarian aspect of also Red Cross, that humans are humans and they help everybody. So if that was any confusion, I hope with this I have clarified it. Thank you, Ms. Duncan.
Thank you, Minister. I'd also like to thank the members of the media for being a part of this morning's broadcast. For any further questions, please be sure to direct those questions to the respective ministers and their ministries. Honorable ministers of the council, members of the media, radio listeners and online viewers, this brings us to the end of the live Council of Ministers press briefing for today, Wednesday, February 3rd, 2021. For rebroadcast, be sure to tune in to St. Martin Gov Radio 107.9 FM and also the official Facebook page, Government of St. Martin, and the YouTube channel, St. Martin Cable TV, channel 115. For video on demand, log on to the official government's website, which is at stmartingov.org. On behalf of the Department of Communication and the Government of St. Martin, I am Charity Dunker, and I bid everyone a pleasant day further.